And welcome back to Talk of Alabama. Have you heard of the Kolbe Clinic? They're a treatment center located in Chelsea that helps patients who are dealing with opiate and heroin dependency. We've got Wainscott and Dr. Erin Hanover here with all of the details. And welcome to both of you.
Thank you.
Thanks for being here. Tell me a little bit more about the Kolbe Clinic and what y'all do.
Well, first of all, to understand what we do, you have to understand a little bit about the problem that's going on right now. We have a heroin epidemic. We have an opiate epidemic going on in this country. Nationally, since 2000, heroin-related deaths have quadrupled.
Wow.
And just in Jefferson County since last year, heroin-related overdoses have doubled.
And it's getting younger and younger.
It is. And, I mean, it's a real problem. So we have an opiate dependency treatment center. We do treat all forms of addiction, but we specialize in opiate dependency. We have an excellent professional staff. We have 3 physicians. We have 3 counselors on staff as well. And we're growing quickly. We've only been open since November, but as we grow, we're continuing to add more staff, more physicians, and more counselors.
And, you know, everything that I've read about heroin and opiates, the drug does not discriminate whether it be your class, your race, your gender, because you've got people out there that maybe have a toothache or they end up getting back surgery and then they end up getting hooked on a medication and they turn to heroin, right, as a substitute.
Absolutely. Well, heroin on average is about 1/10 of the cost of legal prescriptions that are sold illegally on the street. So it's roughly $1 a milligram for those prescriptions, and heroin is much cheaper, so they tend to turn to that just for cost savings.
Now, how do you treat dependency there? Do you use medications to treat, or how?
We do. We use counseling as the main form of our treatment. However, we do use buprenorphine. People also know it as Suboxone, but that's something I'll let Dr. Hanover speak more about.
Absolutely. So we do. So we use buprenorphine, or as many people know it as Suboxone, to treat opiate dependence. It's what's known as a harm reduction strategy for the treatment of dependence. It's a medication that prevents patients from being or experiencing opiate withdrawal, so they're able to be in kind of a comfortable, steady state. It also allows them to, stay out of withdrawal. So therefore, they are able to, kind of function and go about their normal lives.
And how does that compare to, say, a methadone, which a lot of people know about?
Right. So actually, both medications are used for the same purpose. They're both used to treat opiate dependence and, again, keep patients out of withdrawal. The main differences would be that buprenorphine or Suboxone is a partial opiate agonist. It also has a shorter half-life than methadone, meaning it stays in a patient's system for a shorter amount of time. What that kind of translates to is that the buprenorphine has what's called like a ceiling effect, meaning that patients don't have a high from it. Overdose is very rare with Suboxone. Usually if there was an overdose, it would be because there was a combination with other drugs of abuse. So it's really a safe, effective way to keep patients stable while they're focusing on other aspects of recovery.
And how do you think, in closing, that your clinic is different than others out there?
Well, I think compassion for the patient and patient care is our main focus. I think a lot of our patients really need someone to be on their side. They really need someone to have confidence that they can do better than their lives have become to that point. And that can make the difference between success and failure. So I think our professional staff is extremely good at showing compassion to the patients and making sure that they understand that we know that they can get through this and that they can turn their lives around. And that makes the difference.
It does make a difference. And what I've read, you guys have had great success as far as people overcoming and responding to this approach. So how can people at home get more information?
They can give us a call. Our number is 618-9899, and they can also look us up online at kolbeclinic.com.
Okay, again, kolbeclinic.com for more information, and at Dr. Erin Hanover and at Wainscott, we certainly appreciate your time this morning.
Thank you so much.
They are located in Chelsea. Go look them up for yourself.